Lab values part 1. A client with congestive heart failure is about to take a dose of furosemide. Which of the following potassium level, if noted in the client's record, should be reported before giving the due medication? A 5.1, B 4.9, C 3.9, D 3.3. The correct answer is D 3.3 milliequivalent per liter. A client went to the emergency room with a sudden onset of high fever and diaphoresis. Serum sodium was one of the laboratory tests taken. Which of the following values would you expect to see? A 130, B 148, C 143, D 139. The correct answer is B 148 milliequivalent per liter. A client is brought to the emergency department, states that he has accidentally been taking 2 times this prescribed dose of warfarin. After observing that the client has no evidence of any obvious bleeding, the nurse should do which of the following? A. Draw a sample for activated partial thromboplastin time level. B. Draw a sample for prothrombin time level and international normalized ratio. C. Prepare to administer vitamin K. D. Prepare to administer protamine sulfate. The correct answer is B. Draw a sample for prothrombin time level and international normalized ratio. A male client with atrial fibrillation who is receiving maintenance therapy of warfarin has a prothrombin time of 37 seconds. Based on the result, the nurse will follow which of the following doctor's order? A. Administering the next dose of the warfarin. B. Increasing the next dose of warfarin. C. Decreasing the next dose of warfarin. D. Withholding the next dose of warfarin. The correct answer is D. Withholding the next dose of warfarin. A client is receiving a continuous intravenous infusion of heparin sodium to treat deep vein thrombosis. The client's activated partial thromboplastin time is 77 seconds. Based on this result, the nurse anticipates which of the following prescription? A. Maintain the rate of the heparin infusion. B. Decrease the rate of the heparin infusion. C. Increase the rate of the heparin infusion. D. Discontinue the heparin infusion. The correct answer is A. Maintain the rate of the heparin infusion. The nurse is handling a pregnant client who was prescribed to have an alpha feta protein level. The nurse should explain to the client that this blood test A. Can indicate lung disorders and neural tube defects. B. Abnormal levels are associated with an increased risk for chromosome abnormality. C. One of the alpha feta protein levels are abnormal and amniocentesis will be ordered. D. An alpha feta protein is a definitive test for neural tube defects. The correct answer is C. Once the alpha feta protein levels are abnormal, an amniocentesis will be ordered. Which of the following laboratory results indicates hypoparathyroidism? A. Serum potassium of 3.6. B. Serum calcium level of 4.3. C. Serum phosphorus level of 5.7. D. Serum magnesium level of 1.7. The correct answer is C. Serum phosphorus level of 5.7 milligram per dl. An adult male client has a hemoglobin count of 12.5 gram per dl. Based on the result, the client is most likely having this due to which of the following noted in the client's record? A. Emphysema. B. Client living at a high altitude. C. Dehydration. D. History of an enlarged spleen. The correct answer is D. History of an enlarged spleen. A screen test for detection of human immunodeficiency virus reveals a positive ELISA exam. Which of the following tests will be used to confirm the diagnosis of HIV? A. Indirect immunofluorescence assay. B. CD4 to CD8 ratio. C. Radioimmunoprecipitation assay test. D. P24 antigen assay. The correct answer is A. Indirect immunofluorescence assay. The client went to the emergency room with a sudden onset of chest pain and difficulty of breathing. Which of the following result is indicative that the client is experiencing myocardial infarction? A. Myoglobin level of 98. B. Troponin T of 0.09. C. Troponin I 0.5. D. Creatinine kinase 155 units. Correct answer is A. Myoglobin level of 98 microgram per liter.